We all know that managing child protection cases in humanitarian situations can be a complex and stressful process. Caseworkers shouldn't be expected to handle it alone. They need ongoing support to provide the best level of care to children and their families. Ongoing training, as well as consistent and structured supervision and coaching, equips caseworkers to handle the complexity and stress of their work and to consider a child's best interests throughout the case management process. Training is particularly important for new caseworkers joining an agency, and it should be provided right from the start. At the same time, supervisors require focused training in order to provide caseworkers with the administrative, developmental, and supportive supervision they need. In humanitarian situations, many agencies respond to help those in need. To provide the best care, they should work together to develop a joint capacity-building plan that addresses the training needs of child protection case management teams. The Child Protection Case Management Training for caseworkers, supervisors, and managers is a key resource when it comes to building skills and strengthening the capacity of these teams to provide safe, responsive, and supportive care to children in humanitarian emergencies. Developed by the Case Management Task Force, this training resource includes a facilitator's guide and 7 modules, along with PowerPoint presentations and handouts to support the facilitation of role plays, activities, and case studies. It also provides sample agendas and tips on organizing and customizing the training. The training is organized across 4 sections, including the foundations of child protection and case management, the case management steps, self-care, as well as designing, implementing, and supervising case management services. The training package provides guidance to child protection managers on when to establish case management services and how to implement them. It also helps to build the numerous skills and core competencies that caseworkers need, from communicating effectively and safely with children, their families, and other communities, to analyzing children's vulnerabilities and advocating with legal, health, education, and other actors. The knowledge and skills gained through the training empowers case management teams to safely and ethically manage cases according to the interagency guidelines for case management and child protection. In addition to the case management training, the Case Management Task Force has also developed the Interagency Child Protection Case Management Supervision and Coaching Training Package. The Supervision and Coaching Package strengthens the capacity of supervisors to communicate effectively and provide feedback to caseworkers. It also offers guidance around promoting staff well-being within the case management team. Along with a facilitator's guide and 4 training modules, the Supervision and Coaching Package includes the Caseworker Capacity Assessment Tool. This is a key tool when it comes to assessing caseworkers' attitudes, knowledge, and skills, and it informs the areas of development that supervisors should prioritize in individual or group supervision sessions. Other important tools for supervision that are included in the package are the Individual Supervision Record, the Case Management Meeting Record, the Shadowing Tool, the Observation Tool, the Case File Checklist Tool, and the Case Discussion Tool. In addition to these trainings, another valuable capacity-building resource is the Best Interests Procedure Training, which was developed by the UNHCR and the International Rescue Committee and focuses particularly on the skills needed to carry out safe and effective best interests procedures, in particular for refugee children. Additionally, the Caring for Child Survivors of Sexual Abuse in Humanitarian Settings Guidelines and Training Package was developed by the International Rescue Committee and UNICEF to build the capacity of service providers working with children affected by sexual abuse and their families. With ongoing training, as well as consistent and structured support, child protection case management teams can provide responsive, compassionate, and ethical care to vulnerable children everywhere.